Hi, my name is Pamela Coy. I'm the Orthopedic Spine Nurse Coordinator here at El Camino Hospital, and I'd like to meet with you for a few minutes to help guide you through the process of what to expect post-operatively. So I hope this information is helpful, will make you feel more relaxed and less stressed about what is to come. I'd like to start with welcoming you to El Camino. Following surgery, you will go to the recovery room for about an hour and a half, and after the recovery room, you will come to the Orthopedic Pavilion. On the Ortho Pavilion, we have specialty trained nurses that are, many of them are orthopedic certified, and we will be caring for you throughout your stay here at the hospital. One of the first things that we will address with you certainly is pain management. You will have a private room on the Ortho Pavilion, and as the nurses have probably mentioned, you will be able to have a family member stay with you if that is what you would like and if that will make you feel more comfortable. The orthopedic program is wellness focused, so we encourage family to be involved, to observe physical therapy, and to know how they can best assist the patients when they go home. So once you arrive on the orthopedic unit, we will be taking your vital signs frequently. We will be assessing your pain, assessing your ability to move your extremities, and overall giving you an assessment of how you're feeling. So let's start with pain management. That is the reason that our patients are here, and it is one of the key components to your recovery by allowing us to help manage your pain effectively after surgery. There is not any such thing as a pain-free surgery, but the key is to manage your pain and to keep your pain at an acceptable level, at a manageable level, so you are able to get some rest and so you are able to be productive with your therapies. So I'd like to explain to you what some of the methods of pain management are and what you can expect. To start with, after surgery, we will be delivering your pain medication through your IV. You will have the IV started prior to your surgery, and then our pain medications for the first day or so are delivered through that IV because they work quicker and so they're more effective. So one of the ways of doing that is by using a machine called a PCA. PCA stands for patient-controlled analgesia. So what that means is that we have this pump here that's attached to your IV pump, and we have a way of allowing you to access the medication yourself. Patient-controlled analgesia means that your physician is going to prescribe the medication. We are going to put the syringe with medication in here. It's attached to your IV tubing, and you have access to that medication when you need it, but within certain limitations. So the prescription that the doctor gives us tells us how much medication you can receive per dose, a time delay between dosages, and a maximum per hour. So how you access the medication is with this button. Now when this is programmed and plugged in, this will be a bright green. When you need your medication, you push the green button, and that tells the machine to deliver the medication into your IV. When it is bright green and flashing, that means the medication is being delivered to you. And then when it becomes a flat green, such as this, that means it's during the delay time between injections. And when it lights up bright green again, that means that it is time for you to receive your injection if you need it. It is patient-controlled analgesia. That means that the patient is responsible for pushing the button, not well-meaning caregivers and family members. We want to protect you and keep you safe and prevent any oversedation or respiratory depression. It is very important that you communicate to the nursing staff about your pain. We need you to let us know the intensity of your pain by using the number scale that you're very familiar with. We would like to keep your pain in the lower end of the range from 1 to 3, and avoid letting the pain get out of control and getting up into the 9 and 10 range. If we can stay on top of your pain and better control it, you're going to have a better recovery, you're going to use less medications overall, and you're going to be able to be up on your feet quicker and progress more rapidly. So there are different kinds of pain specifically with spine patients. It's not at all unusual for a patient to experience spasms along with the surgical discomfort. So that is why we need a patient to really describe what the quality of pain is, using adjectives such as cramping, tight, sharp, shooting, throbbing, aching. Whatever the description best fits what you're feeling. With knowing what your pain feels like, we're better able to manage it with the right kind of medication or with positioning or with ice therapy. There are a number of ways we can help make you more comfortable. So communicate, communicate. That really is the key to pain management. Once the PCA is discontinued or your IV medications are discontinued, then your physician will start you on oral pain medications, and those will be provided to you according to your pain level and also according to his prescription. We want to offer the pain medication to you routinely as it's ordered, and we want to assess your pain. And please, if we are not right there with you when you feel that you need your pain medication, please ring the nurse's call light and let us know that you need your pain meds, and we will provide them to you. Ask us any questions you have. It is very important that you understand the medications that you're taking and that you understand how to take them here as well as when you go home. Okay? Your surgeon will also give you a prescription for pain meds for when you go home. We will make sure that you have all the instructions about those medications so you understand how to most effectively take them when you go home. Another way that we help manage a patient's pain, besides pain medications, is through mobility, repositioning, and also cold therapy. So it's very possible that your surgeon will order a cold therapy machine for you to help with pain management and reduction of swelling around the surgical incision. So this is an example of the ice machine that might be ordered for you. This is electric. It plugs into the wall. We fill it with ice and water, and that water then circulates through this pad, which actually lies against your back. So when you're in bed on your back, this will be surrounding the surgical incision area, and it provides cold therapy rather than ice packs, which are larger and bulkier. This would be more comfortable. If this machine is ordered for you, it will go home with you. It is for one single patient use, and you may use this according to your surgeon's instructions for as long as you need to, several times a day when you go home. So ice therapy is very important to help reduce the swelling that you might experience. So once you arrive to the Orthopedic Pavilion and we make sure that your pain is managed, it's time to start moving forward and progressing through your recovery. And the way we're going to do that is by getting you up and walking you on the same day of surgery. So it is our goal to have you up on your feet as soon as you possibly can, as soon as you want to, but within a time frame that the physician specifies. The guidelines that we follow are that a patient gets up on their feet and they start walking with nursing in less than 8 hours after arrival to this unit. So some patients walk as soon as 15 minutes after they arrive. Some, it's a couple of hours, and it all depends on how you're feeling. We want to make sure that you're medically stable before we get you on your feet, but we will get you up and walk you within a few hours after arrival. So early ambulation has many benefits. It helps with pain management. It helps prevent complications, it helps expedite your recovery, and it helps enabling you to be discharged from the hospital sooner. One of the key benefits of early ambulation is prevention of blood clots. Blood clots can occur from prolonged bed rest, from anesthesia, many hours under anesthesia. So there are a variety of methods that we use to help prevent a blood clot from occurring. The number one best way to prevent a blood clot is by getting you up and walking you. The other way is by having you wear these stockings on your lower legs. These are called sequential compression devices. These are stockings, they plug in, they inflate, puff up with air, and they gently squeeze the calves of your legs, one leg at a time, to help increase the circulation of the blood back up to your heart to help reduce the risk of a blood clot. We do not give anticoagulant medications to a spine patient following surgery, so we use the sequential stockings and ambulate you to help prevent blood clots. I'd like to show you a couple of items that you will have attached to you following surgery, and I'd like you to know that these are perfectly normal parts of the procedure. And one of those items is a urinary catheter. This is the catheter bag, so this collects the urine. The urinary catheter is placed into the patient's bladder when you are up in the operating room once you're asleep. You will have it in place for about 2 days, usually no more than 2 days following surgery. And the reason for the catheter is because anesthesia can slow the body systems down. We want to make sure with the pain medications, with anesthesia, that your bladder is emptying spontaneously. So the catheter is placed, and this is completely mobile. We hang this on the walker that you will use to ambulate in the halls, and then we will remove this by the second post-op day. Another item that you will become familiar with is this device. It is called an incentive spirometer. This is a tool that we provide the patients with to help you with your lung exercises following surgery. By having our patients do lung exercises, it will help you prevent respiratory infections and a buildup of secretions, which potentially could lead to pneumonia following surgery. The exercises that you will do are exercises to help inflate your lungs using your diaphragm. So when you breathe with your diaphragm, such as when you take a deep yawn, that will inflate the cells in the base of the lungs and help you take in more air and more oxygen. This tool is what we provide you with post-operatively. You will begin with empty lungs, and you will place the mouthpiece in your mouth. You will take a slow, deep breath, such as when you yawn, and this diaphragm will rise. We want you to raise the diaphragm as far as you can and then exhale, letting the diaphragm fall to the bottom. You will repeat that process 5 to 10 times every hour while you are awake. This will help decrease post-op fevers and help decrease the potential for pneumonia. In talking about your mobility, there are certain guidelines that a spine patient needs to follow, and these are basically good body mechanics. And these are to help you protect your spine while you are healing from the surgery, but also to help you protect the rest of your spine. We call these neutral spine principles. And there's a simple acronym that you can follow to help remind you of these movement guidelines. This acronym is the word BRAT, B-R-A-T. B stands for bending. We want you to bend with your hips and your legs. We do not want you to bend forward with your spine. By using those proper guidelines, you will help protect your spine as it's healing. R stands for reaching. We want you to reach within the normal limits of your arms and not reach beyond your arms, which will stretch your spine. A is for arching, so you will not sleep on your stomach. We will have you sleeping on your side and your back, and we will help you turn from side to back to side frequently so you maintain comfort. T is for twisting. So we don't want you to reach across your body because that naturally then causes your spine to twist. And we want you to get used to turning your body. So if I'm approaching you and I want to say hello, don't turn around by twisting to look at me. We want you to get used to turning your body. So BRAT is the acronym for neutral spine principles. These are basic good body mechanics that you will follow for some time, And many of those guidelines will be incorporated into your life permanently to help protect your spine. It's not only the area of the surgery that we want to heal well, we also want you to help protect the rest of your spine from injury in the future. Physical therapy will see you twice a day while you're here in the hospital. They might not see you the day of surgery because of the length of your surgery, but they will start with your therapy sessions first thing the next morning. They work with you twice a day. They will help teach you how to get in and out of bed properly, following your neutral spine principles. They will walk with you. They will provide exercises to help strengthen your extremities and your core, and they will work with you on stairs so you can adequately maneuver your steps or stairs when you go home. Occupational therapy will also work with you on a daily basis. OTs are the ones that help you with your activities of daily living. That means your dressing, your grooming, your daily hygiene, being able to maneuver around the kitchen, doing your laundry and so on, all following your neutral spine principles. They will also issue you some equipment to help you be more independent when you go home, and those items would be a reacher, a sock aid, a long-handled shoehorn, and a bath sponge on a long stick, so you can be independent in the bathroom for your daily hygiene. Another member of our care team is our discharge planner or our social worker. One of them will see you starting the day after surgery, and we will actually start planning for your discharge actually as soon as you arrive to the hospital. Our discharge planners help coordinate any of your needs following your discharge home, such as your need for a walker or a commode chair, or home physical therapy if ordered by your surgeon, or even extended rehab services if your surgeon feels that that would be best for you. They will meet with you, explain the orders of your surgeon, and arrange for your needs. Please let them know if you have any equipment currently at home, and they will keep you informed every step of the way. Your length of stay at the hospital varies depending on your procedure and how extensive the surgery is. A spine fusion patient is generally with us anywhere from 2 to 6 days, depending on the procedure. Most of our spine patients go home following surgery. Sometimes it's beneficial for a patient to receive extended rehab following surgery so you are as safe and independent as possible by the time you are discharged to your own home. We do have an acute rehabilitation center on site here at El Camino Hospital Los Gatos. If those needs arise for you, you will have that discussion with your surgeon, and they will help you decide which facility would be most beneficial to you. Also, when you go home, your activity will be defined by your surgeon. Most patients do not go into outpatient physical therapy right away. Your therapy will be to walk at home, to walk frequently. We do not want a patient to go home and remain on the sofa watching TV all day. We want you to get up and walk frequently. So you will not be walking one long walk a day, but walk many times a day in your house, outside, down the sidewalk, and when you do go outside, please make sure someone is with you so you are safe. Walk, walk, walk is the therapy of choice following a spine surgery. Your doctors will let you know what activities you can and cannot do right away, and then they will let you know when you can reincorporate other activities into your lifestyle as you heal. Following your discharge, you will receive a phone call from one of our staff members here on the Orthopedic Pavilion. We want to check in with you and see how you're doing, see how you're feeling, and to see if you have any questions or concerns. If at any time, once you go home, you are concerned about your clinical status, please make sure you call your surgeon with any questions. Thank you for choosing El Camino Hospital and allowing us to participate in your care.